it's Yasmine, and welcome back to Doctors Who Wear Pink. So today, if you haven't noticed, we were missing my lovely co-host Emily. Um, it's a tough week for the second years right now. I will say it is like we just started neuro, and if you are a medical student, you would understand what that means. So a lot of lectures, a lot of studying, and we have like two unrelated neurology exams this week. So a lot is going on. So definitely give us a little bit of grace during this time. And hopefully we can get her back for the next one. But yeah, so today I interviewed lovely Erica. She is incredible. She actually helps like lead like monthly meetings for our Christian Medical Dental Association. Her and her husband are two really awesome residents, and they actually went to UF for medical school. So I always just love yapping with her, and so having her on was just like incredible. And I got to ask her like some of the questions I've been dying to know. But yeah, so stay tuned for that. Just wanted to make like another PSA. If you haven't picked up on it already, these episodes are being pre-recorded. So we are pre-recording it now in the hopes of releasing in the next month or two. Again, we're medical students, gotta give us a little bit of grace. And so you guys might realize like the timeline of things that we're talking about may not be exact to when they get released, but hopefully there's still super interesting content and that you guys will enjoy it. So yeah, with that, we will move on to our conversation with Erica. Thank you guys. Hi everyone, and welcome back to Doctors Who Wear Pink. Today we are chatting with Erica. She is a radiation oncology resident, and we're so excited to have her. So Erica, I guess to start, we can just have you introduce yourself.
Sure. Thanks for having me, Yasmine. I'm excited. My name is Erica Braschi, as you said. I'm currently a PGY4 in radiation oncology at the University of Florida. A little bit of my backstory. I'm originally from Puerto Rico. I came to the States towards the end of high school, went to undergrad in North Carolina, then down to University of Florida for medical school, stayed here for residency. I'm married to my husband, Den. He's a radiology resident here at UF as well, and I'm also an expecting mother with a baby due in November. So I think that covers covers everything.
Covered all the bases, which we will hopefully get into. But first, I just want to kind of ask, like, kind of what led you to medicine and to radiation oncology?
Yeah, so what led me to medicine? I always looked up to doctors growing up. When I was little, so my grandfather and my aunt are GI doctors. So when
Yeah.
I was little, I would say, I want to be a doctor or a professional tennis player. And I think both are still
Right,
true statements, although
right,
the
right.
ship has sailed for me to become a professional tennis player. But truthfully, as the years went on, once I was actually entering college, I was undecided. I was privileged enough to play D1 tennis, and I thought it was impossible to do pre-med and be a student athlete. So I
Mm.
kind of discouraged myself in the beginning from even trying, and I tried to, take a bunch of different classes and find a different major, but naturally was drawn to the sciences and ended up um, reconsidering going into medical school, and I volunteered some primary care doctors, and this really confirmed that this is what I could envision myself doing. I really liked the idea of helping people in a vulnerable state and then combining this knowledge, what I was learning in the classroom, with personalized care and conversations. And I longed for that human interaction and the challenge of continued learning. And so all of this ultimately led me back to medicine, and then further along into working with cancer patients specifically.
Yeah.
Um, so you asked about why radiation oncology.
Yeah.
It's funny because it's a very small specialty. You don't really hear about it um, in most medical school curriculums. I think we're really fortunate that at UF we have a rad onc department
Mhm.
that is introduced. Radiation oncology is introduced in our cancer course. I think it was first year of medical school was the first time I heard about
Yeah.
it. Um, and so that piqued my interest, having a lecture in radiation oncology. And then we also have the preceptorship they offer. So it's like a clinical experience in your early years of medical school.
Mhm.
And it's funny, I got a bad lottery number and nobody had signed up for radiation oncology. So I said, I'll see, I'll check it out. And so I ended up going doing radiation oncology for that 1 or 2 week preceptorship.
Yeah.
And I really enjoyed it. I try to keep an open mind my third year when I started doing clinical rotations, but again, found
Mhm.
myself drawn to cancer patients and really enjoyed meaningful conversations with them.
Mhm.
I think cancer is one of the scariest diagnoses for patients to receive, and so it felt rewarding to go into a field that helped with that patient population. And then why specifically rad onc as opposed to other oncologic specialties? I think that's a good question. I think I would have been happy doing either medical oncology or surgical oncology too. I
Yeah.
think rad onc was the best fit for me. I really enjoyed the outpatient setting, the lengthy conversations and consultations we have with the patients. I like that it was treatment oriented as opposed to diagnostic. I really like the technology, the creative aspects of radiotherapy treatment planning, how multidisciplinary it is. You know, you work with dosimetrists, physicists, therapists, all to achieve the common goal of coming up with the best plan for the patient. And then I think lastly, but perhaps most importantly, is I had really great mentors here at UF. I think
Mhm.
specifically the rad onc department that we have here had a lot of physicians that I aspired to be like and really encouraged me and took me under their wing in medical school. And so that really inspired me and I think led me in that direction.
Oh, that's so awesome. Yeah, we got introduced to it like in February, and they actually had someone give a lecture on what radiation oncology is. So it's funny that you're like, oh, when we picked preceptor, like it was just like one of the last ones there. Like so many people in my class signed up for it because they're like, wow, like this is so cool. Had no idea that this even
Yeah,
existed.
I feel like it's a hidden gem. I wish
Yeah.
more students knew about it.
Mhm.
And I think we're trying to change that. We're trying to expose medical students earlier and earlier. Um, but yeah, it's definitely a more niche specialty. And I think a lot of medical schools don't have home programs, home residency programs or departments, and so they may not
Yeah.
hear about it. But yeah, I love it, and I love that our faculty gets involved in the medical student lectures as well.
Yeah, oh, that's so awesome. Would love to just hear, I guess, what a day in your life looks like as a resident. I know, like, you mentioned that you're on your research year right now, so I know that looks a little bit different, but I guess like typically what it would look like. I guess as a med student, I'm like, I can't even like conceptualize what
Yeah.
all you guys do in a day.
Yeah, I mean, that's fair. Every day is very different as a radiation oncology resident. As you mentioned, right now I'm on my research elective time. And so I'm not in the clinic as much, but typically any other year of residency, we work one-on-one with an attending in the clinic, and typically that attending focuses on about 2 to 3 disease sites
Mhm.
and you work with them for a total of 3 months. And so during each rotation, your week is divided up into clinic days and non-clinic days. So on average, we have about 3 clinic days and 2 non-clinic days that can vary. Some attendings see more patients than others. Some have more like admin or academic time.
Yeah.
But on clinic days, we see a mix of new consults, so patients that are coming for the first time to discuss whether or not we recommend radiation.
Hmm.
We see on-treatment visits, so patients who are currently getting, a lot of patients get radiation for multiple weeks at a time, and so we see them once a week to talk to them about how they're doing, side effects, things like that. And then we also see follow-up visits. So these are patients who received radiation in the past, and now we're seeing them for surveillance. So you have a mix of those patient visits throughout the day. And then you also have your non-clinic days that you spend more time focusing on treatment plans and designing those treatment plans for your patients. So this
Hmm.
includes like what we call contouring. That's when you're looking at a scan and you're delineating the tumor, which is your target, and the
Yeah.
organs nearby. And so it kind of looks, if you haven't seen it before, it kind of looks like we're drawing structures on a scan. Um, But it does take a lot of critical thinking and creativity to optimize the best plan for your patient, and you're working with your attending and dosimeters and physicists to really make the best plan for them. So that does take time. And then on non-clinic days, I'll also work on prepping notes for upcoming visits. Um, we dedicate time to research. It's an important part of our specialty as well. And then scattered throughout the week, we also have didactics. So we'll have physics and radiation biology lectures, clinical rad-onc lectures led by our faculty, or we give lectures to each other as residents.
Yeah.
We'll have tumor boards or chart rounds. So it's a little bit of everything, but I would say like the average work hours, although it can vary. Again, sometimes you'll be there earlier, sometimes you'll stay later, but it's typically about 7:30 a.m. to 5 p.m. Monday through Friday, and then weekends are off unless you're on call or you choose to do extra work on those days. And there are times where you will end up doing some contours at home or studying at home and things like that, but
Mm.
it's typically your work hours are during the weekdays, which is
Yeah.
nice.
That is nice. Also sounds like a lot. And I'm sure I mean, I can't imagine how much learning that's gone on in like these past few years of just being a resident. What do you think has been, I guess, like the hardest
Mhm.
and like the most rewarding part of your journey so far?
Yeah, I think the hardest and the most rewarding part is working with cancer patients,
Yeah.
seeing people go through tough treatments and have to deal with toxicity from treatment, or
Hmm.
just, as I mentioned before, it can be really emotional to receive a cancer diagnosis and to witness them coping with that while they're also putting their body through something difficult. Um,
Yeah.
but I think it's also the most rewarding part because oftentimes you have the opportunity to build rapport with patients and you have that continuity of care throughout their treatment. And then you get to see
Mhm.
them hopefully months and years later. Um, and I would say, even in the palliative setting, when you um, are working with a patient that has incurable disease, you can still have deep, meaningful conversations with them and come up with ways to help them, even if you can't necessarily, you know, cure their cancer or you don't
Yeah.
have a curative intent treatment. Um,
Yeah.
Aside from that, I would say the other most rewarding part is working with the people I get to work with. Our residency program is like a family. I love my co-residents, my mentors, our staff. So I do get excited to work with these people and go to work. So I
Yeah.
think that's just bonus.
Oh, that's so awesome. Yeah. I can definitely imagine it being difficult to work, with cancer patients every day, but I also can see that those conversations are like super important, even if, you can't exactly cure what's going on with them, but at least you
Yeah.
can be like a place of like solace and comfort. So that's really
Yeah,
cool.
for sure. And I'll add that delivering bad news is also a tough part of the job.
Yeah.
Um, a lot of times by the time patients come to us in clinic, they're already aware of their diagnosis and their
Yeah.
stage. But sometimes we're meeting them before they've really processed this news. And so having to readdress that or address it for the first time is, it's hard for us to, we don't want to give anybody bad news, but we
Hmm.
have to be honest with our patients and give them a, realistic view of the situation. So that's something
Yeah.
I typically don't look forward to, but it's an important part of the job.
Yeah, definitely. So definitely would love to just get to know like you a little bit more. And you mentioned that you are married, and so I was wondering, when did you meet your husband?
Great question. So I met my husband in medical school.
Mhm.
We were first year medical students, and we actually met during orientation week. So there was an event with the Christian Medical and Dental Association, CMDA,
Mhm.
and we met there, but I don't remember the moment we met. I think we just quickly became friends after that, and we're in the same friend group for a while. And it's funny because I think when he started crushing on me, he would make me Anki cards and send them to
Wait,
me.
that's awesome.
Yeah, so he was like helping me study for exams, and I should have taken the hint then, but I truly thought we were just friends. And then one day after an exam, he asked me on a date. And to be honest, at the time, I was so stressed with school. I was like, I don't know if I have time for a boyfriend. But I'm really glad that I gave him a shot. And I think I really started to like him after that date. And now I love him so much. I'm obsessed with him. So
Oh my
I'm
God.
glad it worked out. But yeah, it's a funny story because I think, he was pursuing me for a while before I
Yeah.
realized that he was interested.
Yeah. Was that hard to navigate, like dating someone within your class?
In some ways, yes, in some ways, no. I think um, in some ways it was very natural and easy because we were both doing the same thing and we understood each other. And so we
Yeah.
were spending countless hours studying, and there were days that we didn't see each other or we studied in each other's presence, but it wasn't really quality time.
Yeah.
But of course, we could empathize with the other person because we knew that why we were making the sacrifice and how time consuming medical school is.
Hmm.
Of course, there were times where the stress of exams was overwhelming for one or both of us.
Yeah.
It was fun to have someone to lean on and also learn with. Um, I'll add that I'm also more competitive than he is. He's definitely the more mature one in the relationship. So he's definitely the steady one, and I think it would have been more difficult to do med school without him. Um,
Yeah.
but there were times where I would compare myself because he just was a more chill, calm person. And I was like, man, I feel like I'm struggling more than he is. But ultimately, I think working together, he made me a better student and also a better person. And so now I look back and I really cherish that time that we had together. And yeah, I think of course, there were hard times, but I wouldn't have had it any other way.
Yeah. Oh, that's so beautiful. I know that there's probably like pre-meds that are maybe one day like hoping to like meet their future spouse in medical school or, people in medical school right now going through something similar. I guess like, do you have any advice for those people?
I would say if you meet the right person, I mean, looking back, I wish I hadn't been so hesitant to even go on a date with my husband because I was stressed with medical school. I think, if you meet someone that whose values align with you, who and you're ready for a serious relationship, I wouldn't let medical school or whatever stage you're in kind of you know, uh, stop you from giving that a shot.
Hmm.
But I also think, there's no rush. I know that there's pressure in your 20s and or 30s or whatever to meet someone. And so I think just make sure that you have your priorities and that you're not compromising school just to find someone and vice versa. But if the right person comes along, I say go for it. And it's important to have also that work-life balance and have your personal life as well and have
Yeah.
people around you that care for you, whether that's a partner or friends or whatever. I would say important to keep those things in your life as well. Don't just pause everything because you're in medical school or doing your
Yeah.
training. Um, it's good to have some balance in there too.
Yeah, that's great advice. I feel like definitely as someone who's now a second year, I feel like looking back at first year, I was like, I had so much more time, like my first semester to like, go on trips with friends on the weekends that are like, med school friends or like non-med school friends from like other areas of my life. And I'm just like, why did I do that? Why didn't I just like you can literally study for like 24 like hours a
Yeah,
day, like if you wanted to. But it will always work out. And now I look back and I'm like, the weekends that I was so stressed that I was like gonna take off or like, like all those little things, I'm like, I still did fine. And I don't think
yeah,
it would have like changed anything. And so
yeah,
that's really great advice, just like honestly in general, because you can't just like hit the pause button on your whole entire life in
yeah,
medical school because
for
that's just,
sure. And
yeah.
the same goes even with like keeping your hobbies and doing things outside of school that you enjoy. I know in the beginning in medical school, it was hard for me to keep doing some of the things that I loved. For example, I remember second year medical school, there was a hard block where I was studying so much that I actually stopped playing tennis. And tennis is usually it's my outlet. It's the way I
Yeah.
exercise. And so I stopped doing that. And I noticed my mood, it was not in a healthy place. And
Hmm.
it was affecting my studying, ironically, that I was just spending all my time doing it. And so,
Yeah.
um, I spoke to the counselor at the medical school. One of the first things she told me was start playing tennis again. Like, do make sure you have those hobbies and things in your life
Yeah,
that, um, can be outlets when you're really stressed like that. And so I picked it back up and I kept playing third year, fourth year, even in residency. And so
that's
it's kind of
awesome.
fun. So make time for those things for your social life, for your, relationships, and then also for just the fun things you enjoy doing. Find the time for them.
Yeah, definitely. One thing I was just so curious about, and I'm sure other people are maybe like thinking they're going to be in a similar situation or in a similar situation, especially with like ERAS coming up, like having to submit. What was it like couples matching? Like, what is that whole process like even about?
Yeah. Oh, I could talk about this for hours. I'm so grateful we couples matched successfully, but to be honest, it was one of the hardest things at the time for
Yeah.
me. I think, so we were newly married. We got married early-ish in our fourth year, and so right
Mhm.
in the middle of application season. And up to that point in my life, I had only made decisions for myself when it came to, big decisions where I'm going to move, and I'd never really had another person in mind. And now I'm
Yeah.
all of a sudden I'm sharing everything with this person and it's about us, not just me.
Yeah.
So that was a little hard to wrap my mind around, to be honest. Like I think I was just a selfish person in some ways, but also like we both have our own individual hopes and dreams, and so I think the process we applied to many programs. We weren't unsure how many interviews we would get. We had to be bold and really persistent with some programs because sometimes they would offer me an interview and not my husband or vice versa. And so we really had
Mhm.
to work together to make sure that we were at least getting some interviews in the same places. And then the way we did it is we made separate rank lists and then compared them. And in our situation, they seemed completely different. So that was stressful because we were having very different impressions about
Yeah.
the programs we were interviewing. And so we ultimately made a list together and we prioritized the things that mattered most to us as a unit rather than individuals. And that meant sometimes compromising places that as individuals we may have ranked higher.
Mhm.
However, we knew the whole time that we were really blessed and fortunate to have home programs that we already liked and we would be happy to stay if they wanted us. I had strong mentors at UF in the radiation oncology side, and he felt the same way with radiology. And so it turned out we matched in our home program, and we were really thrilled about that. But the whole process, it taught me a lot. I think it was one of the first tests in our marriage, to be
Yeah.
honest. But I'm really happy with how it turned out,
Yeah.
especially because we get to train in the same place, and that ultimately was the most important thing for us.
Yeah, definitely. You mentioned having to like really be bold about like reaching out for like I guess the interviews. Like if you got one he didn't, like are you guys supposed like with couples matching, do you normally supposed to like each get one? Like how does that work?
So you apply to the same programs and then
Yeah.
but essentially and then your application does mention that you're couples matching, but it's completely up to the individual program to decide whether they want to interview you. So just because, say, the radiology program at an institution wants to interview my husband doesn't necessarily mean that they're going to reach out to RadOnc and be like, interview Erica.
Yeah.
So it's kind of you um, you're at the mercy of both programs wanting to interview you. And so there were times where one of us got interviewed, not the other one. But since we were couples matching and we wanted to go to the same place,
Mhm.
we did our best to try to get both of us an interview. And sometimes it didn't work. Sometimes we would email the program and just say like, hey, my husband got an interview with the radiology program, and so we're really interested. And so you would kind of hint at the fact that, um, if they were able to offer you an interview, you would really
Yeah.
appreciate it. And sometimes the answer was no. Sometimes you were put on the wait list. But I think a few times it did actually help us get some interviews. And so that was the advice I received from, more senior students that had successfully couples matched. And so we did the same thing. We had like a template email and we would send that when like one of us got an interview and the other one didn't.
Yeah.
And then another thing is, say that they said no to one person and interviewed or wanted to interview the other one. Sometimes I did withdraw my interview just because I knew that I wanted to match with him. And so I didn't want to just interview knowing that we weren't going to rank that program and take that slot from somebody else. And so
Yeah, that's fair.
there were a few times where he and I both had to withdraw some applications.
Yeah. Was any of it kind of like heartbreaking? Because you mentioned having to like apply to the same places. Like, was there ever like a program where you're like, oh, I really like this program, like pre you guys like being together? And then like he's like, oh, I really don't like they don't have like a good like radiology department. Like, you know what I mean? And then you're just like, oh, like that's so heartbreaking that now I have to like not apply to that school or like can't even like interview there.
For sure. I think we both felt that. I'm more expressive with my emotions, so I think he got to hear me struggle through that a little bit more.
Yeah.
Because the programs can really vary, even though they're in the same institution. Sometimes you just get a feeling when you're interviewing and you're like, wow, I'm um, really aligning or vibing with these residents. And then, he might feel differently with the radiology residents he was interacting with.
Hmm.
I know in my case, I did an away rotation in Texas and I really loved it. I would have been so happy to match at that program, and he didn't, unfortunately, didn't get many interviews out there, and so that did affect our rank list, and that was a hard pill to swallow. Um,
Yeah.
but I think ultimately, like I said, we were at least grateful throughout the process that we knew that we both would be happy to stay at our home program. Of
Yeah.
course, like you're still hoping that your home program wants you. So we were like excited, ultimately excited when we opened our letters. But yeah, it was a lot of conversations, a lot of,
Mhm.
moving programs around on the rank list. And I think if we had been applying individually, maybe our list would have looked completely different, to be honest. But
Yeah.
together, it was just right for us.
Yeah. And that's so awesome that that works out. It definitely seems like a very like really tough process and just having to remind yourself that like I mean at that point you guys were married so you like are choosing to spend your life with this person and that I can imagine means a lot more than, going to a program that maybe that you really loved but like wasn't gonna work out for the other person. But it is really awesome the fact that we have like such amazing like residency programs here and that you guys were able to stay.
Yeah, for sure.
Yeah. Do you have any advice for maybe, couples who are kind of going through that process together now?
Um, I would say it sounds so cliche, but be patient and trust the process. I think also if you're couples matching, it's because you are really prioritizing being with your partner. And so,
Yeah.
um, like I said, it's just a heads up is that you may need to compromise when it comes to your rank list or where you interview.
Hmm.
But ultimately, one of the my favorite things that I went back to the med school counselor after the match because there's so many emotions that people don't prepare you for. It's like both the happiest day and then also a day full of what ifs. Like, what if I had done my rank order differently or in our case we had so many friends that were leaving Gainesville, and even though we were excited to stay, we were like, oh, they're going to these cool new cities and we're
Yeah.
staying in this place. And so I went back to the counselor to just talk out my feelings, and she was really helpful. She had me fill out, how you have those little signs that say I matched at blank. So
Yeah.
had me fill one out that said I matched on November 7th, 2021 with my husband's name. And it was basically like I found my match and he's the most important thing in my life right now. And so
Yeah.
that reminded me that that's the whole point of the couples matches. We wanted to stay together
Yeah.
really at all costs. And so um, that really changed my perspective and made it even more exciting that we ended up matching together. And then also just be grateful if you match. So many,
Yeah.
unfortunately, people will go unmatched or they'll be unhappy with where they end up. And so I think it's normal to feel a mix of emotions on that day, even if you match at your number one place.
Yeah.
But if you match, that's already a huge achievement, and you should be very proud of that.
Yeah. Oh my God. That's so like that's really sweet and like sentimental and like such a good visual way of like grounding you into like the whole point of the couples match. I was like about to cry. I'm like, that's beautiful. And like that's
Right, that's okay. I'll try.
I just start bawling my eyes out. You're just like, there. Okay, amazing. Yeah, no, that's awesome. I like honestly haven't even like talked to anyone that's like done it. Thankfully for me personally, my partner is like not a med student, but I know just like there's so many people who are like planning for that right now and like it is such a like ambiguous process and of course they're not the first ones to do it, so they're likely hopefully have people who can like answer their questions, but I'm glad we got to talk about it a little bit more in depth because hopefully that can like help people who are kind of like about to go through
Sure. It's a big commitment. It is. I'm also happy to help anybody.
it.
I don't know if there's a way you can give out my contact info, but I'm happy to help anyone through the process because I
Oh,
remember
that's so kind.
going through it, it wasn't that
Yeah.
long ago.
No, definitely. Kind of the next like set of questions I want to ask is more about just like, women in medicine and like mentorship. Did you ever have like a predominant, female mentor that kind of influenced your path currently?
Yeah, I've had several. I could mention so many people, honestly. I feel like, um, faith is a big part of my life. And so I truly feel like God has placed incredible role models throughout my entire life. But in medicine specifically, it's been encouraging to have more seasoned females to guide and champion me along the way.
Yeah.
For example, in medical school, my small group leader was a female pediatrician, Dr. Howell. You might know her.
Love Dr.
Yeah, she's
Howell.
just so intelligent and passionate about medicine and medical education while also being an incredible mom and wife outside of work. And so she
Mhm.
helped me a lot in medical school, showing me it was possible to do both and be called to both. And she was also just encouraging in those seasons where I was like down or didn't think I was going to make it through medical school. And so I feel like I owe her a lot. And then in radiation oncology specifically, again, I could go on forever. We have a strong female presence in our department,
Mhm.
and they're all excellent at what they do. And aside from being exceptional physicians, they're also just really kind, humble women with a desire to inspire the next generation of rad oncs. And
Yeah.
I'll give two special shout outs, Dr. DeLeo and Dr. Bradley. They've opened doors for me to participate in rad-onc research since I was a medical student. They've gone above and beyond. Now I get to work with them as a resident, which is really cool. But they've gone above and beyond to invest their time to teach me and then also really care about me as a person. They've showed up for me even outside of a professional setting. And so I think a common theme among the best mentors in my life is that they care about my development, not just academically, but also as a
Yeah.
well-rounded person. And so they've been amazing support professionally, but also great emotional support. And I'm grateful for all the ways that, older generations have paved the way for,
Yeah.
current trainees like myself. And then I think also I have female co-residents that are amazing. I interact with them the most on a day-to-day basis, and they definitely continue to inspire and encourage me as well.
Oh, that's so awesome. It's really, yeah, I feel like it's so helpful to have, a mentor, especially I feel like for me, my CLG leader is also like a woman in medicine. And so like I always ask her questions about like having like kids and like getting married and just like all the extra things that not necessarily like our male counterparts don't have to like deal with or think about, but maybe we have to think about just a little bit more.
Yeah.
So that's amazing to have like so many like really powerful like female mentors in your life. That's
For
awesome.
sure. And I mean, even just, I guess, a really specific example recently, they threw a baby shower for me at work.
Oh, that's so cute.
And it's like, I mean, that was really all the staff, even beyond just the female. But seeing how excited they've been, especially the moms that are in medicine, they've
Yeah.
experienced starting a family either during their training or after. Um,
Mhm.
And so to have their guidance through that as well, has been just so valuable for me.
Yeah.
Mm.
And with that, I really want to I guess, ask you about what it was like as a resident, kind of having those conversations about like family planning, like you wanting to, have a baby and, all of those things that kind of go around it. What was that like?
Um, Honestly, I approach those conversations, just I was really upfront and honest. I think from the beginning, I stated that it was a priority for me, even when I
Yeah.
would meet like one-on-one with the program director. I never kept that a secret. I think that obviously there are faculty members one is always going to feel more comfortable with than others, sharing those more personal conversations about, life outside of work. But thankfully, I've felt really supported by everyone in our program. I think it's important to communicate that family life is a major priority while also acknowledging that even though family life is important, residency is hard and will require sacrifices, and you need to be willing to work with your program to successfully complete your training and do it well.
Yeah.
I think part of, aside from having these conversations, it gives you credibility to work hard and be the best resident you can be, because
Mhm.
that builds trust between you and your faculty and mentors and shows them that even though you care about things outside of medicine, you're passionate and serious about your job. So it's not like you're going to slack or, just like, quit or whatever
Yeah.
just to start a family. I think it's mutual, like you support them, they support you, and you're willing to work together. But my experience, I don't know, I can't speak for all the residents in the world that have started families, but with us expecting, I think I've received an overwhelming amount of support, even more than I would have
Yeah.
imagined. And a lot of our faculty members were even emotional finding out that I was
Sweet.
pregnant and excited for me. And so, um, that's been really nice. I'm really grateful for it.
Oh, that's so awesome.
Yeah.
And you are about to deliver soon, aren't you?
Yes. Yeah, I'm due in about 6.5 weeks. So we're
Oh my
getting there.
goodness. That's so crazy. Yeah, like what do you, I guess it's hard to know and plan everything out perfectly because obviously things come up and like this is going to be your guys' first child, but I know you're in your research year yet now, but then you go back for another year, right?
Mhm.
Yeah. So what do you think that's going to look like? What are some challenges that you foresee and what are some conversations that you've had to kind of like mitigate that?
Yeah, that's a great question. So as you mentioned, this is our first. I've never done this before, so obviously a lot of it is just, there is an element of, I think, normal nerves and anxiety about how the whole process is going to go.
Yeah,
But yeah, the timing actually is great. Like I said, I'm currently on research elective. I do have some clinical rotations this year, so it's not a whole year of research.
true.
But the way it works is we get 6 weeks of maternity leave, and then you can use PTO sick days to kind of extend that a little bit.
Mhm.
And then I'll have some research elective months where I'm working from home. And I think, when you're working from home, you're still working, you have tasks to complete. And so definitely we'll need some help, childcare, things like that.
Mhm.
And then once I go back to the clinic again, it's kind of, we're trying to figure that out right now, what kind of childcare we'll need. We do have some family support. So we have family that's coming temporarily to help us take care
Yeah.
of the baby. But yeah, you definitely, I think there's a lot more factors, things to think about, like breastfeeding, when you're gonna
Yeah.
pump during work. Are you gonna send your kid to daycare? Are you gonna do a nanny? Are you gonna have, a family member? So there's a lot of elements that I think, it's a little bit hard to navigate. And to be honest, we haven't fully figured how all that is going to work. But like
Yeah.
I said, one of the the best things is that I do have uh, female mentors that are doing it right now. One of our attendings has a young she had baby earlier this year. So I looked to her for advice. I looked to other friends, colleagues, co-residents, or residents in other specialties that have recently had babies and figure out what they're doing.
Mhm.
But yeah, it's a lot. I think it's a lot of uncertainties right now, but you see people doing it, and I think that's definitely very inspiring. And I hope to, once I have it a little more figured out, inspire, the next resident I meet that is going through it,
Yeah.
starting a family in residency.
Yeah. Oh, that's so awesome. Do you maybe have any advice for women who are residents right now that are kind of, having the same thought process of, wanting to have a kid during residency, and kind of just like planning for that?
Yeah, I mean, I think that's um, it's very personal. It depends on what timing works best for you, and your significant other. So I don't think there's, a best time to have a kid.
Hmm.
Um, but at the same time, I know that for us, we really wanted to start a family. And of course, we had those hard conversations of should we wait till after training?
Hmm.
And the advice I received from a lot of people, a lot of physicians in our life is that, again, there's never a perfect time. So
Yeah.
if you're ready, your significant other is ready, then I think you should go for it. That's my personal opinion. Um, but yeah, I know it's not there's not really a formula for it, or there's
Mhm.
not a perfect time to do it. You're going to be busy as an attending, you're going to be busy as a resident, you're going to be busy in
Yeah.
medical school, and so um, I wouldn't let waiting for the perfect time stop you from doing it now if you're in a place to start a family. So, yeah, I know that's pretty vague advice, but it's just so, it's so dependent on the couple and what
Yeah.
situation they're in.
Yeah, I think that's really great advice. Honestly, I need to like make a shirt that's like there is never like the perfect time, which I
Yeah.
feel like is such a common theme for literally everything in medical school. Because like everyone puts so much pressure like on themselves to like be perfect, like
Mhm.
in all things. And some things get kind of like pushed aside, but it's like if you don't do it now, like there's just like there's never going to be a perfect time. And that goes for
Yeah.
anything, like not just, planning to have a kid or anything like that.
Yeah, for
So
sure.
no, I thought that was really great advice. And I can't wait to see the future baby girl or baby boy. We don't
Yeah.
know.
Yeah, we don't know the gender yet, so I'm excited to, have that surprise and reveal it to the world once
Oh
we
my
have
God.
it.
That's gonna be so awesome.
Yeah.
I guess to kind of just start kind of wrapping things up, would love to know if you have any advice for women in medical school or early training about kind of just finding their voice in a clinical setting and, really finding the path that they're supposed to be on.
Yeah, I mean, this may be more a personality thing. I know something I struggled with in medical school and early on in my training, and honestly, even still now, sometimes, although I've gotten better, you kind of have to lose your shame and shyness a bit. I think sometimes out of trying to seem polite, I would undermine myself or hold back from saying something or asking something, or I would question
Mhm.
myself or my judgment. And I think there are ways to be humble and respectful while exuding confidence and being unashamed to ask questions or, challenge people, especially when it pertains to a patient. Um, I think patients and colleagues want to see that you're confident in what you're saying.
Yeah.
And even though you'll never know everything, it's good to trust what you've learned, and what you know so far and, be able to speak with confidence. But again, it's not an arrogant tone or anything like that, but, be sure of yourself. I think when, uh, people compliment you, you just have to accept it. I know for a while I would just sell myself short and be like, oh, that was lucky, or,
Yeah.
somebody helped me or whatever. I think it's okay to say thank you and, accept that, you're learning and you've learned a lot up to this point. And, especially when you get to residency, you're a physician and own that. Um, and I think also give credit where credit is due and treat others with respect, and that'll get you a long way. So I think some of that advice maybe is more relevant for somebody with my personality. I definitely have, um, I have girlfriends that, are really, really confident, from early on, and they would step
Yeah.
into clinical rotations and just, go for it, ask the questions, not be shy. But that's something I struggle with, and I think sometimes it held me back from learning, from a learning opportunity, or from even showing what I know, what I've studied.
Hmm.
And maybe I didn't seem very confident in front of the patient. And so I say, like, trust it, go for it. And if you mess up, then it's an opportunity to learn, and it's
Yeah.
okay. You don't have to know everything.
That's awesome. I love hearing that even just for myself because like we're gonna be in the hospital so soon and I'm like, I'm not gonna know like half of what I'm supposed to know by the end of third year. So like knowing that it's okay to just like mess up and it's a good time to like learn and just like put yourself out there and ask questions, I
Mhm.
think is like the best advice ever.
Yeah, like try, volunteer to do that procedure and try
Mhm.
it. Of course, like with proper supervision. It's not like
Yes.
go, do whatever by yourself, but with
Yeah.
proper supervision and having the humility to be like, I need help. Can you guide me through this? I've never done this before.
Hmm.
So ask the questions. There were so many times where I was like, that's probably a dumb question. They're gonna think I don't know even what I'm supposed to know at this point.
Hmm.
But attendings that you work with, they're there to teach you. Of course, their main job is to take care of the patient, but they're also there to teach you. And so, they shouldn't be making you feel bad about asking certain questions. And I wouldn't let that fear of, maybe not sounding like the smartest person in the room stop you from learning something that you could have learned that day.
Yeah, definitely. Well, this has been so great, Erica. Thank you for coming on and thank you for talking to me and sharing your story. And I think honestly, so many people who are listening are going to really benefit from kind of everything that you've talked about and the advice that you've given. I know a lot of those things I'm definitely going to keep in the back of my head when I get to those parts of my journey. Um, but with that, just want to ask, do you have any like last minute general advice or any other comments that you kind of just wanted to make?
Um, I have a few things in mind. I think just in general, it's a really exciting time to be a woman in medicine. Like I mentioned earlier, older generations have really opened these doors for us where we now have so many opportunities compared to years
Yeah.
ago. And so take advantage of those opportunities, be grateful for the work that you get to do. It's
Hmm.
so easy throughout your training to get jaded and complain because it's tough work to be entrusted with people's lives and health.
Yeah.
But it's such a privilege and honor, and I would also add to that, try to always do right by the patient. It's not easy, and sometimes you may ruffle some feathers, but
Yeah.
if you approach it with, with respect and humility, and just communicating that, you're advocating for the patient, then I think it's, important to keep that in mind. And then we talked a lot about finding mentors, people to lean on. I think that's important, not just in work, but outside of work too. So find, that community, find outlets, people to go
Yeah.
to when times get tough. And for me, that's my family and my faith community. And I honestly couldn't do it without them. And so that's my encouragement to anyone listening. But thank you so much for having me. This has been really fun. I'm always happy to chat about anything. And yeah, I remember very vividly being in your shoes in medical school. And so, yeah, time flies, but I know that in the moment, it's a lot to juggle with your courses and then starting clinical rotations and all of that. It's not an easy journey, but it's a really special one. And a lot of people, would really want to have that opportunity. So,
Yeah.
enjoy the process as much as possible.
No, that's such a good reminder. I really appreciate it. All right. Well, thank you everyone for tuning in. And I guess we'll see you guys next episode.